I was looking around, and I kind of had, of course, in the back of my mind, the idea of privatization in general, whether we're talking about prison, we're talking about healthcare for people in the general population outside of prison, like privatization ends up selling out people's health. So, so I knew, there would be a privatized angle. Massachusetts does not have private prisons. So it just so happened, I looked at the healthcare thing, and then it just so happened that last summer, the contract was being switched from one contractor, one business, to another that contracts with the state. So I actually thought it was going to be like a 30-day story or a 30-day reporting process.
Right.
So I reached out to some people, some sources and stuff last summer and said, hey, what are you guys seeing? What are you guys hearing? And they all got back to me and they said, we're obviously keeping an eye open and an ear open, but it's just too early. Like, we don't have enough information. And so they were very cautious about overstating anything, which, was appropriate. So then
we could say their name. Wellpath was the company on the way out.
Yes.
And there was a new contractor coming in.
VitalCore was coming in.
And VitalCore is coming in. So
these names are horrible, by the way.
Yeah, I know. VitalCore.
I feel like we're watching some Schwarzenegger movie. It's the evil co.
So I got with Wellpath. There's no need for hyperbole. I mean, they were being sued just all across the country, and I mean, they were called out by Massachusetts people, Congress people from Massachusetts. So this was like, how much attention did you pay before we get to VitalCore on Wellpath, on the company on the way out?
Yeah, I mean, I was very aware of it because there was so much reporting on it nationwide. And I mean, truly like sickening stories that you can find from outlets across the country. And, shout out to all the small independent outlets across the country that have covered a lot of those stories. And just really sickening stories of people being denied care, dying. So I knew that, but and so I looked into Wellpath, but primarily just because of the timing. I wasn't looking so much at Wellpath. I was more so looking ahead at the new contractor, kind of, if the state says that they're going to be different, let's try and examine that and see if that's the case.